We're thrilled to have you. It's 12:35, and now that we have most of our crew here of presenters for the beginning of the program, we'll go ahead and get started. My name is Holly Wellborn, and I am the new Executive Director for the Children's Advocacy Alliance. It is such an honor to work with folks. I know many of you and some of you are becoming new partners in this adventure with me, and I'm looking forward to working on the full spectrum of issues. I want to take a moment to recognize a couple of people who you won't see very much on this program. I first want to acknowledge Dr. Tara Rains, who does a variety of stuff for us, but she's focused on our Kids Count initiative and also assisting with the legislature. And she'll be helping me throughout the course of the legislative session. And I also want to recognize Bells and Case lobbying firm. We've been working with Bells and Case, and they have been our lobbyists in the legislature for the past legislative session, and they'll be joining us again. So for any legislators who might be listening, they would be a point of contact. Dr. Rains would be a point of contact. So will I for the upcoming session. So today, that's what we're here to talk about. We're here to explain a little bit about what Children's Advocacy Alliance is and some of our priorities lead the legislative session. We focus our work in 4 major umbrella policy areas. And those areas include the children's health, it includes safety and welfare, it also includes education, but specifically early childhood education, those early opportunities for children to learn. And it also includes the equitable treatment of children in schools. And then we also focus in the area of economic well-being, so things like housing policy, childcare, issues like that help children to be as successful as possible as early in life as possible. We create our priorities by looking at what the most pressing needs are in each of those issue areas. Where is Nevada failing kids? Where are we doing okay, but we need more improvement? We analyze this through organizing coalitions throughout the year by participating in task forces and different work groups, and by listening to parents and children who are impacted by the policies that are impacted by the policies that our decision makers advance either through the legislature or the regulatory process. We pride ourselves on working with legislators and other decision makers to advance policies that lead to better outcomes for children, but we will aggressively fight to push back on policies that hold kids back. Today, our policy team leads will discuss legislative issues in the areas of health, safety and welfare, education, and economic well-being. And we'll discuss those matters with some legislative leaders who care passionately about Nevada's children. We have Senator Fabian Donate, Senator Melanie Scheibel, Assemblywoman Claire Thomas, Assemblyman David Warner, and Senator Roberta Lang joining us for a conversation in some or all of those areas today. At the close of each segment, there will be an opportunity for you to ask questions. Please drop those questions in the chat, in the Zoom chat, and we will answer those. Dr. Rains will be assisting us in fielding those questions, and we will ask those at the end of each segment. So you'll have plenty of opportunity to ask questions today. So without further ado, I'd like to introduce Carissa. Carissa is our health policy manager. She's a student at UNR pursuing her master's degree in public health. And I will turn it over to you, Carissa.
Thank you, Holly. Hello, everyone, and thank you all for being here. My name is Carissa Pierce, and I have the pleasure to serve as the Health Policy Manager with Children's Advocacy Alliance. Health is a huge topic, and we at CAA recognize that there are many ways that we can improve health and well-being of our children and families in Nevada. Today, the health focus will be on legislation related to updating the language for fetal alcohol spectrum disorder and Medicaid provisions, including continuous eligibility for children and continuous postpartum coverage. We also want to give space to the senators and assembly people who have joined us today to speak on their policy priority areas related to children's health. With that, we can get started with the legislative priorities. We welcome Senator Melanie Scheibel, Senator Fabian Donate, and Assemblyman David or in liquor. Thank you for joining us today. First, we'll turn to Senator Doñate. Senator Doñate serves as the chair to the Senate Health and Human Services Committee, and it's my understanding that you also have a degree in public health. That's what I'm currently pursuing, as Holly said, so I really appreciate the opportunity to talk with you today. What are yours or the committee's session priorities in the area of children's health?
Sure, and thank you so much. And it's a pleasure to meet you, Carissa. I'm very excited to share that I'm also a UNLV School of Public Health grad, so thank you for mentioning that. For those who I haven't had the chance to interact with yet, my name is Fabian Doñate, and I represent Senate District 10, which is in Central East Las Vegas. And I also have the opportunity to serve as the incoming chair of Senate HHS. We've had a lot of discussions as to what our healthcare system should look like, especially in a world of post-COVID-19. And considering that we're still in the recovery efforts of the pandemic, I think it's important that we make sure that we improve on our infrastructure moving forward. The opportunities that we had during the interim was we passed a few bills, bill draft requests that are going to turn into bills this upcoming session. And most of them deal on a whole range of issues. We're looking at how we can help support the juvenile justice system to better assist children throughout that process. We're trying our best to make sure that youth who are experiencing homelessness receive the services that they need throughout their diagnosis, and of course, in any of the processes that they encounter. And then I think there's definitely going to be some discussions as to what the clinical oversight of behavioral healthcare looks like for our children and families. Those are all bills that we're looking to have this upcoming session. And I think that for the most part, we're very excited to pursue legislation that fixes a lot of the gaps that we're seeing in our delivery system throughout the state. For me personally, I have a broad interest specifically in making sure that we're reforming our health systems to better support public health. I think that unilaterally, we've heard from many stakeholders time and time again that our healthcare system is severely underperforming, and our public health system in general does not have the adequate funds necessary to support the work that we do. And so I hope that this upcoming session, we can continue to have strides in those conversations, and that we can continue to support expansions of Medicaid and clinical care. I have been at the forefront of making sure that every child and family is able to receive the care that they need, regardless of their immigration status, regardless of who they are or where they come from. And I think that's something that I look forward to sharing in the coming weeks, specifically on how that legislation will roll out. So happy to answer any questions, and thank you so much for having me here today.
Great, thank you so much. That sounds like you have a lot going on, a lot on your plate, but we appreciate all that you're doing. Assemblyman Oren Licker, as the vice chair of the Assembly Health and Human Services Committee, same question to you. Are the priorities for your committee the same or slightly different? And what are some of your personal priorities?
Well, thank you for including me, and I thank you for allowing me to do so by phone. Sorry, it's complicated, but the senator did a nice job outlining some of the priorities that came out of our joint interim committee on health and human services. I'll add a couple things. One is to make sure that people, teachers and other people who work with children in schools, child welfare system, juvenile justice, are trained to identify and assist kids who are commercially sexually exploited or at risk for being commercially sexually exploited, so that we can identify early on and intervene to protect these kids. Another thing that we're going to do is make sure that we have better services in schools for healthcare services in the schools, so-called school-based health centers, to make sure we do a better job of meeting the needs of children. And then a third thing is, we know we have a serious problem in Nevada, like the rest of the country, with substance use disorder. And one of the good things is that medication-assisted therapy can do a lot. And the downside is that it's not being used as much as it should, whether in the prison system, in the court system, or even by providers, that there's a reluctance to prescribe. There are barriers to becoming a prescriber for medication-assisted therapy. And these are, an important way to think about people with substance abuse disorders is they have a chronic disease. They're addicted to whether it's heroin or other drugs, and and addictions are something that can be lifelong and need management. And just like a lot of other diseases, whether you have depression, you're going to need lifelong medication, or you have diabetes, you're going to need lifelong medication. Same with substance use disorders. And if we can get patients on the right medication to address their substance use disorder, then they can be gainfully employed, they can and then earn enough money to afford a home and to take care of their families and lead a fairly normal life. And as I say, we just need to make sure that those kinds of treatments are available for the people when they can benefit from them. So, so in addition to the programs that Senator Darnyate, the bills that he and I talked about coming out of interim health, some of the things I'm interested in is one is with nicotine and tobacco. We fortunately now have the 21 age limit. You can't, as a minor, you're not legally allowed to buy tobacco or vaping products. And there are other steps that I want to take to reinforce that program. One is not all people who sell vaping products or other or tobacco products adhere to the 21 age rule. And so there's a lot of evasion. And so it's important that we audit sellers regularly, and we only do it every 3 years. And so I want to increase our frequency of audits so we make sure we have better compliance, and that also affects federal our qualification for federal funding. So we want to make sure we receive that. The other thing that one of the reasons why teenagers like to vape is because of the flavorings, and they've got, fruity flavors and candy flavors, and those are appealing. And I'd like to, so one of the things that I have a BDR, it's 171 that I'm working out the details. That will include the enforcement of the 21 age rule. It will also, I'd like to propose a ban on flavorings. Another thing I'd like to do is, another thing that New Zealand's done that I like, that, and there are maybe some cities that have done this in the States. A small number of places have done this. And that is to say, right now, you can't buy tobacco products until you're 21. Well, what we can say is, and you never should for the rest of your life. So gradually phase out the people who are eligible to buy tobacco products by saying, starting January 1st, nobody under the age of 21 currently and for the rest of their life can buy tobacco products. So every year, fewer and fewer people can buy tobacco products. And then the final thing I'd like to do is to phase out sales of cigarettes, because when you think about what we can do as in health in terms of preventing preventable disease, the biggest cause of preventable disease by far is cigarette smoking. If you add up COVID and guns and motor vehicle crashes and HIV and opioid overdoses, you still don't reach the number of deaths in this country from cigarette smoking. And it's a big health equity issue. Minorities aren't necessarily more likely to smoke, but they suffer the harms from smoking disproportionately. And when you look at the life expectancy gap, which is pretty substantial between minorities and whites, a big chunk of that is from smoking. So I'd like to gradually phase out sales of cigarettes in Nevada so we can do more to prevent, as I say, the biggest cause of preventable death and disease in Nevada and the country. Just a couple other things I'm working on. proposal to make sure to try to bring our Medicaid funding closer to Medicare funding, our reimbursement, because when you talk to pediatricians, one of the biggest problems in terms of access to healthcare for people on Medicaid is Medicaid reimbursement. And it's hard to make sure we have enough providers out there for Medicaid kids when we pay so low. So I want to bring up Medicaid reimbursement to Medicare levels. And I also want to do more, have the state do more to regulate what hospitals charge, because that's the biggest driver of healthcare costs in the country. You know, drugs are important, prices are important, but hospitals are the biggest driver. And in Nevada, they charge more than twice what Medicare pays. Medicare may underpay a little bit, but you don't need to pay 225% of Medicare to be fair to hospitals. And that's what we do in this state. And that makes healthcare unaffordable for too many people. So that's another bill that I'm working on.
Awesome. Well, thank you so much for sharing. I actually remember I saw the campaign that New Zealand is doing for the tobacco, and it was very interesting. So it's interesting you bring that up as well. We have some questions in the chat. I'm going to come back to them once we get through this. So just so everyone knows. Senator Melanie Scheibel, welcome and thank you for joining us today. You are championing a bill related to the eligibility criteria for children enrolling in Medicaid. Can you tell us what you are hoping to achieve with BDR 130?
Absolutely. And thank you so much for having me. It's wonderful to see so many people interested and committed to children taking the time out of their day to be here and talk about some of our policy priorities. The bill that I am introducing this year, I am actually reintroducing to make Nevada a continuous coverage state. And so for those of you who, many of you are already familiar with this concept, some of you may not be, so I'll give you a brief overview. Basically, Nevada participates in the Medicaid program. That's, our state level insurance program for children whose families make a certain income or, below a certain income, they qualify for Medicaid services. Then we also have CHIP, which goes along with it to provide medical services for kids. There is both a state component to Medicaid as well as federal funding tied to Medicaid. And it is more complicated than I think I will ever understand in my lifetime. And that is why I am so lucky to work with the Children's Advocacy Alliance and our state office for Medicaid and so many other amazing stakeholders and champions who've helped me to understand what little I do about Medicaid. So one of the things that I do understand is that every state has the choice to either be a continuous coverage state or not a continuous coverage state. And Nevada currently is not a continuous coverage state. So what that means is that when a child gets enrolled in Medicaid, they are enrolled for as long as they are eligible, but the state can make its own determinations about how often it's going to reassess eligibility and take kids off of Medicaid when they cease to be eligible. Some of the most common reasons that kids would be eligible and then lose their eligibility include their parents' income increasing, even if it's only temporary, moving, and those are basically what we call drop-off. So basically, we don't know where a child has gone, which is kind of scary in a different way. But I'll focus on the income portion, because what we have learned over the course of several years or decades even is that for a lot of families, their incomes are cyclical. And so for most of the year, they might make below that threshold that's necessary to qualify for Medicaid. And then maybe during the holiday season or over the summer, they get another job, an older sibling gets a job, and the household income rises just enough that the kids in the household no longer qualify for Medicaid. In Nevada, they can be taken off of their Medicaid plan as soon as that happens. And what we've been seeing is that generally that assessment is linked with the family's application for SNAP benefits, which re-ups every 6 months. So in practice, our kids are being assessed for their Medicaid eligibility every 6 months. And during that snapshot in time, if one of those 6 months they don't qualify for Medicaid, they will automatically be removed. What continuous eligibility would do instead is say that we are going to fix one time during the year that kids are going to be assessed for their Medicaid eligibility. And it wouldn't have to be the same time for every kid. That would be pandemonium. But, you know, you have 1/12 of them on January 1st, 1/12 of them on February 1st, 1/12 of them on March 1st. And if you qualify on that date, that child would be enrolled in Medicaid for the next 12 months continuously, even if they become ineligible for some other reason. So as you can imagine, the purpose of this is if a child gets qualified on March 1st of 2023, now that family can continue to work, apply for new jobs, increase their income, increase their buying power. And come November or December, if a parent is making more money, they've taken on a seasonal job, they get that holiday bonus, their kid isn't going to lose their Medicaid coverage, because a lot of families, by the time March comes back around, are back underneath that threshold. If they're not underneath that threshold, if they have managed to, you know, increase their household income and they no longer qualify for Medicaid come March 1st, then that child would be dropped from Medicaid. And they would still be eligible to get back on Medicaid if another qualifying event occurred. They wouldn't have to wait until the next March 1st. They could qualify in August and reapply for Medicaid and get back on Medicaid at that time. But the big reason for implementing this policy is that it helps kids continue to get preventative care. Because they remain enrolled in Medicaid for a full year, you don't have the same gaps in coverage that occur when a family goes to see the doctor and they don't realize that they've been dropped off Medicaid and they have to reapply. And then it takes a couple of weeks to get that application approved. And then they have to get onto their MCO, and then they have to find their provider who will accept their insurance in order to go. People aren't doing that to make, you know, a wellness visit, and they're coming to the ER, they're coming to urgent care facilities, they're waiting until the situation is emergent instead of getting preventative care because they don't have that continuity of care. So that is the bill that I am reintroducing this year to try to switch Nevada to a continuous eligibility coverage state so that our kids get coverage for a full year from the time that they qualify for Medicaid.
Great. Thank you so much for sharing that with us, Senator Scheibel. These next few questions can be for everyone, but it is my understanding that Assemblyman Orenlicker has specific interest in updating the statutory definition of fetal alcohol syndrome to fetal alcohol spectrum disorder. Why is this a necessary change, and who is going to benefit from expanding the current language?
Sorry for the delay there. Yeah, we did. This is something that came out of the joint interim committee to make sure that we do provide coverage, because fetal alcohol syndrome is such an important, significant, and unfortunate cause of developmental disabilities. And this is not something I have the greatest background in, but in terms of the legislation, but my understanding is that this is an important way to make sure we provide the services that these kids need and that they, you know, are very important for their development, and that our current code doesn't adequately reach them.
Great. Yeah. Would either of the other senators like to speak on this? Okay. We can move on. So Governor Lombardo recently gave his State of the State budget report and listed that new programs requiring long-term funding would not be one of his priorities. Expanding postpartum coverage in Medicaid falls into the zone of being a potential budget issue. Would you please speak to the expansion of postpartum coverage as it relates to healthcare access?
I'll jump in here if that's a question for legislators, right?
Yes.
Okay. Because we have been working really hard over the last at least many years, including the 2 sessions that I've been at the legislature, to increase coverage, especially for new moms, new parents, and new babies. And so I think that in this biennium, we're always looking for ways that we can spend money that we can spend now that will save us money down the road. And I think that expanded coverage is an excellent example of that, especially when it comes to prenatal, postnatal, and postpartum care, because we know that babies and parents who get care earlier in their lifetimes will need, I don't want to say they'll need less care. Everybody needs care throughout their lifetime, but that care can be significantly less expensive because it's significantly less serious. Caring for a baby that has a mild cold or cough or illness symptom is much easier than caring for a baby that has, years of malnutrition or an illness that has progressed over the course of several months before they got care. And so I think that we will be looking at budget options to expand coverage for prenatal, postnatal, and postpartum care.
Awesome. Well, thank you. We would like for each of you to address this question, but we saw that Senator Donyate, you had posted on your Twitter about concerns that you may have for the expiration and fiscal cliffs for certain programs that have been funded with COVID relief funds. For example, one of our concerns is the end of continuous eligibility for children through Medicaid, but it sounds like Senator Scheibel's bill will hopefully help to address these concerns. But are there any other specific programs that the legislator is fighting to retain this session?
Sure, and thank you so much for that question. So just to clarify, so some of the sentiments that I shared, which is what we're seeing unilaterally across the country, which is we are reaching a stage in the pandemic known as endemicity. So we've been living with COVID-19, and the unfortunate reality is that many of the programs that have been critically stood up throughout the pandemic will now be ending. And whether that is our reliance on federal funding or just the pivoting of our public health resources, that is a reality that many states, including Nevada, will be falling into. And so part of the priorities that we have this upcoming session, at least for myself, is to make sure that we have sustainable funding mechanisms to support public health in its entirety. So we've known for a very long time that Nevada ranks last in public health. That is a statistic that we have recognized time and time again. And part of the initiatives that we have through the interim HHS committee was that we're looking to create what we determine as a public health improvement fund. And the goal of the public health improvement fund is to allocate $5 per capita. So it's about $15 million annually that is dedicated specifically to public health so that we can continue to fund community health workers, so that we can improve access to care in rural areas and so forth. And so that is something that I am very interested in supporting this upcoming session. And I know that there are bills myself that are that's included that we'll be looking at sustainable funding models that can be moved forward so that we don't have to keep doing the reallocations from the general fund. I think that has been the ultimate goal, at least for those of us that work in public health, and I'm excited to bring that forward. So thank you so much for that question.
Yeah, and if I could just add that as the senator said, we need sustainable funding. And one in particular that I'm looking at is for tobacco prevention and cessation. It's been a big success story, the extent to which smoking has been reduced in this country, but we still have a lot of ways to go. And an important way is to make our tobacco prevention and cessation funding sustainable, because that's one of the examples where we have to go back every year to fight for those kinds of dollars, and we get so much in return. It's the return on investment for tobacco prevention and cessation in terms of people living longer, reducing healthcare costs, other economic benefits. The estimates are it costs everybody $1,000 a year because of the cost of smoking. So getting that sustainable would be critical.
Okay, thank you so much for your responses and being here. For the sake of time, I want to open it up to our questions really quickly. I'm going to turn it to Holly to present those questions.
Thank you, Carissa. That was a fascinating conversation, and thank you to each of you for being here. We have a few questions to address, a couple kind of combined, but the first one I think is very important, and it's about misinformation around COVID, around healthcare policies. One person asked whether or not there would be any efforts to combat misinformation that could be generated either through social media or other avenues about healthcare, not just in the COVID context, but just mis or disinformation in the healthcare context.
Sure. Thank you so much, Holly, and congratulations again on your new role. I'll take this one since it's more alongside some of the work that I've already done before. So I recognized back in 2020, actually in the beginning stages of the pandemic, that this was a major issue. And what we know today is it's even more magnified. The issue of misinformation and disinformation, there's a difference between both of those, right? Misinformation is the case where you're unintentionally spreading false records or information of what's going on, and disinformation is the purposeful falsification of facts and information. Both of those are threats to our public health system, and the best way that we can target that, in my perspective, is by making sure that our government systems are aligned and that they're accessible to everyone, regardless of this language that they speak. Last time during the session, we passed Senate Bill 318, which would require that all state agencies develop language access plans so that we're not scrambling at the end to translate documents into different languages. I think that the best way for us to advocate for public health is to make sure that everyone understands and is fully knowledgeable of what's the public health rules and regulations and so forth, and all the efforts that we do unilaterally together should support the community. We should meet folks at where they're at. We should work together to improve health literacy at every level. And I think that's something that we're looking for this upcoming session as well, to continue that. So more to come on how to support the public health pandemic efforts, but I think that's pretty much where we're at right now.
Anybody else want to weigh in on that? Any legislators?
I don't think I can say it any better than Senator Doñate.
Yeah,
That was
there
great.
are, I think it's California that's trying to see if they can take action against the people who, I think they passed a statute that said if you're a physician and you spread false information, that's a grounds for discipline. And now that's being challenged on First Amendment grounds. So it'll be interesting to see if the courts allow some freedom there, because it's a very tricky path to navigate because we have such strong First Amendment protections. And so it may be, as the senator suggested, that the way our best approach to combat the false information is to make sure we get as much accurate information out.
Thank you. The next question, I think really that we had two questions that go to providing incentives for healthcare professionals to move to Nevada or to retain high quality healthcare professionals in Nevada. And one of the questions was providing some kind of financial incentive to people to work here, to get particular healthcare professional licenses, or to relocate here. And then the other question was also about, reciprocity. That's something that, comes up a lot throughout professional licensing schemes, providing reciprocity for licenses. So you don't have to go through the cost and the burdensome, testing or whatever you have to do in order to, work in these different areas. So are there any efforts currently in the legislature to ease some of that burden for people so we can attract and retain healthcare professionals?
Sure, I'll take this one as well. Thank you, Holly, for those two questions. So sounds to me that there's a discussion on workforce, and then there's another conversation on licensure. So I'll try my best to cover both of those conversations. So regarding workforce, I think that many of us that work in this field know full in fact that we suffer from a lot of vacancies. And particularly in our industry, it's very hard to get folks into it, and it's very time consuming just because, when working with individuals, there's a lot of qualifications at take, and it's not an easy job, right? The work that we do is hard, and it's because we're dealing with one another, and oftentimes we're dealing with, in reality, the social determinants of health. And so part of the work that I know folks in the legislature will be doing is making sure that we're supporting the folks that are already in the field, and then that we're paving the way for more people to come in. So I want to just highlight, for instance, a good bill that it would be helpful for you all to remain engaged with is that, Treasurer Conine has introduced legislation that will cover essentially loan forgiveness for folks that work in this space. I know that in a meeting that I was in earlier, the folks in Washoe County on their regional behavioral board have submitted a bill to target loan forgiveness specifically for folks in behavioral health. That is something that we're looking to support. And then at the conclusion of the COVID-19 study that we did during the interim, folks have requested for loan forgiveness to be expanded for all individuals that work in public health. Right now, what we've done before is we've done specific targeted loan forgiveness for medical doctors. And so we're looking to expand that moving forward. In regards to licensure, I think that our goal is always to make it, to not turn anyone away, and to make it as simple as possible while also maintaining quality. I think reciprocity is a conversation that we're always willing to have with folks in that respect. And I myself will be carrying legislation specifically on the licensure of physicians. I think there's a window of opportunity to increase the number of physicians that can go into underserved areas, with respect specifically for folks who are what we consider international medical graduates. That's something that I believe can help with closing the diversity gaps that we see in our healthcare delivery system right now. And that's just one example of some of the licensure changes that we can make immediately within the next few months to support this work. So all that to say, there's a lot of work getting done. I know that our eventual goal is to expand, at least in the interim HHS committee, was to expand tuition remission for state employees. That is a proposal that we believe will help a lot of folks, along with the reclassification of positions. But those are things that can come down farther down the line. And then our immediate goals is to look at licensure and workforce. So hopefully we can provide a lot of relief to some of you on this call and to some of your colleagues.
And a couple other things I'd like to add. Those, as the senator said, licensure, we've had historically too many barriers to people becoming licensed here, and we need to make it smooth that, facilitate that, and make sure we increase the pipeline. A couple of things for physicians. One is what's hurt us, especially in southern Nevada, is we haven't had enough residency programs for physicians, and it's where doctors do their residencies. By that time, when they complete their residency or fellowship, they may be married, have kids, and they're less likely to want to move. So the more, as we grow our residency programs, it'll be easier to bring doctors in who will stay here. And then another thing, when doctors and their families are trying to decide whether to come here, an important factor is, what are the schools like for their kids? And we lose a lot of doctors and other professionals because of our school system. So as we improve our schools, that'll help us bring in more healthcare professionals.
Okay, thank you so much for joining us. We really appreciate all of you being here and speaking today on your policies and what you're working on. So thank you, Senator Melanie Scheibel, Senator Fabian Doniate, and Assemblyman David Orenlicker. I will now turn it over to Annette Dawson Owens to speak with the Assemblywoman Claire Thomas and Senator Roberta Lang.
Thank you so much, Carissa. And that was a great segue, Senator, into education. Good afternoon. I'm Annette Dawson Owens, and I serve as the School Readiness Policy Director for the Children's Advocacy Alliance. We are advocating for various items related to improving education outcomes for our Nevada students, such as school funding, class sizes, safe, effective learning environments, mental health investments, educating students with special needs, out of school time and extended learning investments, etc. And a few topics that we'll talk about in more depth here today are related to restorative justice practices and universal pre-K. So referring to Assembly Bill 65, it is important that our schools are safe, effective learning environments, and it is equally crucial that all of our students are continually educated and provided the supports they need to be successful. It is imperative that education continues to occur and that there are not disproportionate expulsions or suspensions or even permanent expulsion at young ages. Investing in our youth on the forefront and engaging them in meaningful learning opportunities and mentorship is critical for their future and the future of Nevada. Referring to BDR 65, another large return on investment is in our early learning pre-kindergarten focus. Research has shown that the single greatest predictor of a child's success is their kindergarten readiness. Invested in early learning experiences can have as much as a 15% increase return on investment and is an area that Nevada has not significantly invested in and funded in the past. It is our goal to increase access to high quality early learning or universal pre-K and serve at least 70% of our students. We are encouraged by the governor's investment of $60 million toward this effort. We would also like to see an Office of Early Childhood Systems created within the Office of the Governor. Joining us today is Assemblywoman Claire Thomas, who can further speak to the benefits of universal pre-K, as well as Senator Roberta Lang, who can address what the priorities are as chair of the Senate Education Committee. Would you both please share a few thoughts about what you are working on this session, starting with Assemblywoman Claire Thomas?
Thank you, Annette, and thank everyone for being in this summit right now. As far as the BDRs that I've put forward, it is a foundation for universal pre-K. And just like we send our children to school to learn and to be good citizens, I think that we need to, here in Nevada, build on a foundation. And that foundation, my BDRs are 65 and 66, which would one, have an advisory council, and the second would be for the director, early education director, to sit on the council of the governor, so that when the subject of pre-K comes up or anything to do with early childhood education, the voice will be there. In other words, there's a seat at the table. So I thought that those were two areas to build a foundation on bringing to the state of Nevada universal pre-K, because right now we know that there's about 2,500 students that we actually follow in the state, and I declare there has to be more that we should be following right now. And I think that with all the other states that I've had the pleasure of hearing back in August, I believe, through the Hunt Institute Summit, we are again last of all the 50 states to enact universal pre-K. So I believe my BDRs will set the foundation, and going forward, we can go back to the state and say, these are our missing children. This is what we need funding for, and get that funding. And because there's so many, and you know, I'm speaking to the choir right now, and I'm sure that you all know that this is a fundamental age for learning. And if we miss out on this, then we have these problems with behavior, because our kids don't know how to socially act with each other. The learning is behind. I heard the governor say that he wants to reenact the read by third grade. And right there, there's another stigma that you're putting onto these children. Well, if we have pre-K, we can get our kids that foundation going forward so that when they are in the third grade, they can read sixth grade level, you know? So these are some of the things that, you know, I'm looking forward to as a legislator pushing forward. So, and the other thing, just, you know, side note, BDR 790, which is addresses the behavioral schools in the state of Nevada, where the money does not follow the children. I think that that's a big issue. Now, you want their behaviors to change, but you're not giving these educators the tools to enact that change. So that's another. So hopefully I answered all the questions.
Thank you, Assemblywoman Thomas. Appreciate all your efforts in this realm, and we're really excited for the things you're bringing forward. Senator Lane.
Hi, good afternoon, everyone. I'm happy to be with you today. And just to reiterate what Assemblywoman Thomas said, my granddaughter is in pre-K in Clark County School District. In fact, she was accepted when she was 3 years old because she had a speech issue. And it has been instrumental to her preparation for kindergarten. And if every child could have that, it would be amazing. And how much better it would be for all the students entering kindergarten to be able to have pre-K. So I'm very excited about that bill. I want to talk to you a little bit about some of the things I'm working in education. We have over 100 BDRs that have been submitted so far. And we're getting more. There'll be more bills that'll be dropped after tomorrow. And so it's going to be a very busy time in Senate Education. Education is one of those committees where everyone has been a part of. Everyone's been a part of a school district. Everyone's gone to a school. Not everyone's been a parent, but many people have been a parent or a grandparent. And so they all have experience and think they know what is best for students in Nevada. And so we work to take the issues at hand and make education better for the whole state. As you mentioned, we were excited about the money that the governor wants to put into education. The problem with what he wants to do is he wants to put money in private schools without fully funding public schools. I have a problem with that. He wants to, he has all these programs that he wants to do, but yet he has not talked about the teacher vacancies that we already have and the lack we don't pay teachers what they deserve. And so until we can deal with the teacher vacancy in the pipeline and paying teachers what they're worth, it's really hard to look at adding new stuff and supplementing other programs. But I want to tell you about a bill that I'm really excited about that I'm doing this year. It deals with safety, both student and teacher safety, and that's a K-12 mental health curriculum. I'm doing this bill, so it actually is pre-K, where we are asking, and we've worked with the Department of Education, and they have found a way to implement this bill without any cost to the school districts, which is really great. So there are 4 things we want to do, and we want to implement this, and so that kids would get a continual mental health training as they go through school from pre-K all the way through high school. You're looking for triggers, you're looking for ways people can get help, understanding what mental health is, quality mental health, where you might have issues. That creates a safety platform for everyone. If we can get our kids to the point where they can start to recognize when they have mental health issues and how we can get them help. We're also asking that out of the in-service days that the school district gives to their teachers and support staff during the year, that 2 1/2 days would be dedicated to mental health and teacher safety. We're also asking that when teachers go through their teacher preparation program in college, that they take at least one class on mental health preparation as part of their health program. And fourthly, we're asking that when teachers renew their certificates, when they expire and they go to renew their certificate, that they get mental health preparation as part of that renewal process, that they have at least one class. I think all this is critical. The great thing about this bill is I'm carrying this for a junior at the Meadows School who wrote a mental health curriculum that's being used in school districts around the nation already. And it is just short of phenomenal, which he is phenomenal himself. But we have already gotten support from all but one person, which we haven't had a chance to talk to on Senate Education. So I expect this bill to get a lot of support moving forward. Everyone recognizes that mental health is huge in our schools, and safety is equally as huge an issue. And so I'm excited to carry this bill forward as we move it through Senate Education onto the Assembly.
Thank you so much, Senator Lang. There's a couple of questions that I think fit in right now. They're asking what bill number is that?
It's BDR 58. It doesn't have a bill number yet.
BDR 58, thank you. And then there's a question about where will the mental health curriculum be delivered, since currently only high school has a health class requirement for graduation. There is no health class requirement for middle school. And is it evidence-based?
So the curriculum, the student I'm working with, he had psychologists and counselors help write the curriculum, and they vetted it for accuracy. But what the Department of Education does when something is mandated in their schools, they have a website where people can go to that have resources, and they can use those resources to teach what subject area they're going to teach on. And so there'll be a lot about mental health. The way they're going to put it in existing curriculum from K through 12 is through the SLOs. They go all the way from kindergarten all the way through. So it'll be continuum. It won't be like in high school where you only have 1/4 of health. You have 1/4 of health in the middle school, and then just a little bit in the elementary school. It will be continual, and they can grow on the program as it goes through each grade.
Thank you so much for clarifying on that. And then I'm going to ask also one follow-up question from Assemblywoman Thomas. If you could speak to for us to a minute about what the support pre-K does for our workforce, and if and this will go to you as well, Senator Lang, and what, if any, role municipalities play in partnering to ensure students have access to high-quality education in general and early learning experiences.
I'm sorry, Annette. I didn't hear the rest of that. I live in North Las Vegas, and this is either the jets are leaving or they're coming back home. So
no problem.
You could just say that one more time.
Yes, I was just asking about the role that this early learning pre-K can have on our workforce, as well as what role do municipalities have, if any, or can they play in partnering to ensure our students have access to not only pre-K, but also high quality education in general?
Thank you. And thank you for that question. When I'll have to just backtrack a little bit. We all remember, maybe not everybody here remembers, but Head Start. And when Head Start started, some of the parents were able to bring their children into Head Start, which is a precursor for pre-K. And with that, parents were able to be in classes with their children, and that opened up an opportunity for employment. So when I look at pre-K and I look at, we know that we have a teacher's shortage and everything, but when we have a group of kids we also need the ratio between teacher and children. So then you have, a teacher's aide in there, so that we are paying parents again to join the workforce. And, that is a pipeline for them to become teachers. So, and this goes back to Head Start. This is how a lot of the teachers that are teaching for years now, and some have retired, how they got their start through the Head Start program. And this is, with universal pre-K, I always believed that it was a win-win situation where we can get parents back into the workforce, where we can, as parents are working, that opens up the economy, and, taxes, and it's a win-win for everyone. And I believe that this is something that we have to look at in the state of Nevada. It's a good thing. It's not only a good thing for our kids, but it's a good thing for the state of Nevada. And, we want high tech to come to our state. But I had this conversation just yesterday that there was a company that wanted to come to our state, and they were the powers that be were city officials were saying to the company, hey, we can get your kids into Bishop Gorman or Faith Lutheran. And the business owner said, that's really great for me, but I'm bringing 25 people of my employees, and I can't afford to send all of their children to Bishop Gorman or Faith Lutheran. So that right there tells us that we have to change our way of thinking, get our kids and get our rate, I guess that's what we would call it, up, that we can get these big companies to come here to, so we can have better employment. So.
Thank you very much. Gart, I'm going to address your question very quickly about restorative justice. I agree, when restorative justice is done well, it works wonderfully and it benefits everyone in a safe environment. We have not fully implemented it here in Nevada and yet kind of judged the results on that. And so one of the things I think we can do is look for models where it is successful. We have certain schools here where it is happening and being done very well. And so I agree that there's some misinformation there, and we definitely have that on our radar. And we do need to move on time-wise, so I'm going to do that. But if there are other questions, we will answer them at the end and circle back to them. But right now, it is my pleasure to introduce Jamel Nance, who serves as the Prenatal to 3 Initiatives Director, and Dr. Osborne from the Prenatal to 3 Policy Impact Center.
Good afternoon. Thank you so much for having me and being here with us today. This is definitely a topic that is near and dear to my heart. Again, my name is Jamel Nance, and I have the opportunity to work alongside my colleagues at the Children's Advocacy Alliance as the Director of Prenatal to 3 Initiatives. So in this role, I'm able to kind of shift the focus, and we talked a little bit more about that proactive lens to identify ways that early investment from conception all the way through a child's first 3 years of life can demonstrate a high return on investment as a child goes into adulthood. The policy asks that you heard today, like Medicaid expansion, universal pre-K, and eliminating barriers to quality, affordable childcare, are imperative to ensure families with children prenatal to age 3 have the best opportunity for a promising future. As we near the end of the public health emergency, there are several areas that I would like to highlight today to ensure we keep our most vulnerable citizens of Nevada at the forefront of our decision-making. Funding to expand childcare was a crucial part of the American Rescue Plan Act. However, there are continued barriers to maximizing opportunities to expand. And as we mentioned earlier, there wasn't any mention of childcare that was noticeably absent from the governor's State of the State address. One of the key barriers is low wages. And so that was something we talked about in the pre-K area, but it is also rings true for our childcare workers. Professionals cannot afford to stay in the field and are opting to leave the field for higher paying jobs. And so that is our reality, unfortunately, here in the state. Another barrier I would like to highlight and shed more light on today is the missed opportunity for childcare expansion due to HOA regulations that prevent family, friend, and neighbor providers from becoming licensed because they may live in a rental property. Allowing family, friend, and neighbor providers to become licensed while living in properties with HOAs opens the door to expand childcare opportunities for parents that need that access to quality care. Breaking down those barriers to becoming licensed also offers additional opportunities for providers to accept childcare subsidies and expand services to families who may not be able to afford childcare otherwise. So in addition to all of that, we know that when we expand the opportunity for subsidies, we also expand the opportunities for parents to enter back into the workforce. And so that is something that is critical to the development of the workforce here in Nevada. The need for continued investments for childcare subsidies is not just a matter of essential opportunities for early learning experiences, but as I said, it's a critical investment for Nevada's workforce. And so today I have the opportunity to have Dr. Osborne from the Prenatal to 3 Policy Impact Center at Vanderbilt University. Dr. Osborne leads a team of researchers, policy experts, and operational staff who are passionate about improving outcomes for all children through the policy and evidence that her research has provided. Dr. Osborne will share more about the impact of childcare subsidies and its implications for Nevada.
Well, thank you so much for having me. And I've been enjoying being able to listen to all of the amazing legislation that's being introduced in Nevada. And I am just going to share with you briefly a little bit about childcare subsidies and would love to answer questions that you have as well. And the whole purpose of our center is to identify what the most effective policies are that states can implement that actually improve the lives of infants and toddlers and their parents, because we know that if we can get it right in those first 3 years, it makes things like pre-K, kindergarten, and all other age ranges much healthier and better outcomes across the life course. I had a few slides that if you wanted to share, I wanted to start with childcare subsidies and to just make a note of how impactful they are on work. That they are one of the most effective policies that we have that actually lead to higher rates of maternal employment. As most of you are aware, during the pandemic, the rates of employment plummeted for all parents, but for mothers, it was twice that rate than it was for fathers, and the recovery has been much slower for them. And the reason is that they simply don't have a place that they can leave their children and be able to return to the labor market. And so based on the most rigorous studies to date, we know that childcare subsidies, expansion of those, increase both employment and increase earnings for a household. And on the next slide, I just wanted to illustrate, this slide's very hard to read the details, but if you just take a broad look at it, this is the variation across the country in the level of childcare subsidies that we provide to families. That length of the bar is what our biannual market rate studies say is the price of care across states if a family were to access 75% of the market. That's what the federal government calls the equal access target. But states meet that price in many different ways. And they have their reimbursement rates, which are a combination of that first blue color and the navy color. But even within that, that's the amount that providers can get for having a child who has a subsidy. But even within that, parents have to pay a part of that amount. And that is the Navy piece. And you can see that that Navy amount varies widely across the country. And in Nevada, it's one of the highest. That's what we call the copay. And anything left over, families have to pay if they want that higher quality care. If we can forward the slides, I just wanted to take you through how this ends up playing out to a family's actual resources. So what we did was to be able to compare all 50 states and DC to each other, is that we did this simulation with a stylized family where we said, let's take a mom who has an infant and a toddler, and she works full time at the state's minimum wage. And she leaves her children in center-based care, and that center charges the 75th percentile of the market rate, that equal access target. And in the next slide, you can see where we compare states, and we're just using Arizona and Utah in comparison to Nevada for demonstration purposes. But you can see against any state. So we start by looking at the level of resources just by earnings alone. And this is the minimum wage in each of the states. And you can see that there's a big variation just based on her earnings. But she has to leave her children in care. And so then we take into consideration out-of-pocket childcare expenses. And on the next slide, if you scroll down one slide, you'll see that starts to really deplete her earnings quite a bit. In Arizona, it's almost wiped out all of that advantage of those additional minimum wage dollars. In Utah, there is no out-of-pocket childcare expenses. And so although if you see in Nevada, the minimum wage is more than $3 an hour higher than it is in Utah, the level of resources that the family has is only about a third of what it would be if Nevada's out-of-pocket childcare expenses were less. And then in one more slide, you can see when we add in other work supports like earned income tax credit, as well as nutrition benefits, that this is the level of resources that family has. And although there are differences by each state, you can see that they get smaller and smaller when we take into consideration out-of-pocket childcare expenses than they are when we look at earnings alone. In the next slide, I think is my last slide. So you can stop sharing there. I want to be able to answer questions that you have, but really the idea is how important childcare is in a family's resources, both to allow them to work and as a place to help to nurture their children's health. But it's out of reach for so many families to be able to. Sorry, my dogs are barking because it's about feeding time here in Nashville. So they're letting me know that. My apologies.
Thank you, Dr. Osborne. I do see one question in the chat. It says, does anyone know what is the percentage of women receiving no prenatal care in Nevada? Okay, so that might be one that goes back to Carissa when we circle back around. However, I do have a question. In the 2022 Prenatal to 3 policy roadmap, it highlights the point that increased parent employment and access to high quality care should result in improved long-term outcomes. Could you share with us the connection between access to quality care and child outcomes?
Sure. The direct research, meaning those studies that have said, let's look at high quality care and let's follow children over time, has been somewhat limited. In Chicago, they have implemented high quality childcare in certain settings, and they've done long-term studies. And they've shown that children who received high quality center-based care at very young ages have better outcomes with regard to both their reading and math scores, as well as attendance in 4th and 6th grade. But what we know, even though the effects on actual children's, health and well-being have not been studied to the level that we wish that they had, the effects of maternal employment on children's health and well-being are well studied, and they increase resources and they increase children's health and well-being across a number of domains. So that's what we call an indirect effect, where childcare is affecting employment, which leads to better, more resources in the household, lower levels of maternal stress and depression, and kind of more investments in children, both directly and indirectly through parenting. And so those have really important immediate, kind of intermediate, meaning K to grade 3, and long-term, life-term effects on children's health and well-being.
Thank you so much. I think it's important that we definitely utilize the data to really help support us in this movement of early investments. I believe in the chat, Dr. Osborne's team has included a link to the PN3 Policy Impact Center roadmap. And so if you, in your free time, visit that site, it really does show a great comparison on how Nevada fares in relation to other states. And so we use that a lot when we're looking at what are the best policies that produce the best outcomes for children here in Nevada. Utilizing evidence-based strategies like those outlined in the Prenatal to 3 Policy Roadmap are essential when advocating for policies that produce the best outcomes for children. However, we know it's imperative to have that family voice, those real life impacted individuals at the decision-making table. And so later you'll hear from our parent leadership coordinator, Shelly Speck. But first, I want to just open the floor up to any questions you may have for Dr. Osborne.
So I have a question for Dr. Osborne. Guard Jameson on the board of the Children's Advocacy Alliance. Is there any, I mean, we as a nation, we are so far behind Europe. I mean, is there anybody smart in Congress right now that's really trying to push a livable minimum wage? And I would add, we used to have back in the 30s and 40s proposals for a maximum wage, which I also am a big supporter of. But let's just start with the minimum wage. Is there anybody smart back there that's really pushing hard on this issue? Because it is an issue of restorative justice. It is unforgivable what we do to people. So I'm just curious on the national scale, what's going on?
Yeah, it's a great question. Yeah, we used to have wage ceilings, which is why we have healthcare attached to our jobs and time off and other sorts of things that unions fought for. The minimum wage at the kind of US level is $7.25 an hour, and it has been that wage since 2006. And, which we've gone the longest before increasing it than any other time. There have consistently been proposals to increase it to $15 an hour that typically don't go very far. And there are often people who say, well, not very many people actually make the minimum wage. Look, Target pays $15 an hour now. So should we really care about a minimum wage? And the truth is that there are a lot of families who are still earning the minimum wage. And we not only have a $7.25 an hour minimum wage, we have a $2.13 an hour minimum wage for tipped workers and for workers with disabilities. And what we have seen is, the research says that if a wage isn't at least $10 an hour, it really doesn't have much of an impact on improving health and well-being. Increases in the minimum wage are one of the most effective policies to improving birth outcomes. They improve household resources. There's a host of reasons why minimum wages matter. And some of it is that it increases wages above the minimum too. But there are 10 states that will be at $15 an hour by 2026. And there are more states every year who are introducing legislation to have a minimum of $15 an hour. So we're moving in that direction, but I would argue that there's more of a bifurcation. There's 13 states still at the federal minimum, and they're not going to show movement in a long time unless we have a federal change.
Yeah, and I know we have a governor who would veto it, but are any of our assembly people or senators who are here?
You did just increase your minimum wage, and there was legislation this past year that made it so that it was more even. It used to vary based on whether you offered health insurance or not health insurance and so forth. So there have been changes, and you're among those who often contend now, but I'd love to hear if you're going up higher.
If I could just make a comment, and it may seem counterintuitive from a Chamber of Commerce, but the last legislative session, we proposed going to 12 rather than taking 4 years to get to $12 an hour. And given the period of time since 2 years ago, we now know that even $15 an hour is not a livable wage. There's very little you can do in terms of rent or what we've seen of the childcare costs, transportation, housing at $15 an hour. So while we encourage our members to grow their wages organically to maintain competitiveness, we know there are no businesses that pay, at least in Washoe County, or can pay less than $18 an hour or more just to recruit and retain employees. So we see that without federal regulation, which by the way, I'm in favor of, but without it, we're seeing that businesses just can't even make a mark in recruitment and retention unless they're at $18, $19, $20, $21 an hour. And that's market competitiveness that's raising that. It's very disappointing that at a federal level, our representatives in Washington, I doubt they know anyone at $7.75 per hour that makes that. And frankly, even high school students working summer temporary jobs don't make that kind of wage. So it's just criminal in our mind that we look at that wage on a national level and don't feel incredibly embarrassed that there is no federal push on this.
Absolutely.
You got it. Those are incredible comments. I do want to remind people that in order for us to keep the program flowing and to stay on time, that if we could put the questions, any questions or comments you have in the chat, so we can field those and we can ask Dr. Osborne those questions directly. Thank you.
Thank you. I realize our time might be cut. I just wanted to comment really quickly on, because it's related. So Target can raise its prices. It can do other things to pay its workers $15 or $18 an hour, but a childcare operator can't. We just did a big study across all childcare providers in Texas, and the average starting wage is $12 an hour. And the wage that a lead teacher gets with a bachelor's degree is $14.30 an hour. So, the wage compression is huge. They cannot go up because families simply can't afford to pay more. And so unless the state invests and makes it more of a public good, our caring industry is left with very low wages, and it's so impossible to attract and retain quality workers in that environment.
Thank you so much. There's so much to discuss in this area. And we know that although we've had a recent gain, there's still much work to be done in this area. And so I encourage us to continue to have these conversations and continuing to push this forward, because we know the impacts that it will have on our families here in Nevada. Now I'm going to introduce to you our Safety and Welfare Policy Director, Deshawn Jackson, who will do the next segment. Deshawn.
Hello. Good afternoon. My name is Deshaun Jackson, and I have the pleasure of serving as the Safety and Welfare Policy Director with the Children's Advocacy Alliance. My focus is to advance and advocate for child welfare related issues with a focus on youth and foster care. I have the pleasure of overseeing the state's Youth Advisory Board and Clark County's foster youth group, FATE. These groups are made up of dynamic youth and young adults who have experienced foster care, the juvenile justice system, and many others. These groups advocate for improvements and advancements across the state. As the session begins, there are many bills we're advocating for and hoping will improve our current systems. Of those, we're advocating for the increase in CAA funding. Youth and young adults in Nevada have not seen a permanent increase in their monthly stipend for over a decade. And with the unending price increases, the cost of living is at an all-time high, with no decline in sight. These increases place Nevada's aging out foster youth in a precarious situation, leading to food insecurity and housing instability, among a plethora of other damning possibilities. For many, these youth don't have family to turn to. They don't have a support system that they can lean on in times of trouble. They are forced to embrace a world without the tools or resources needed to ensure their success. We are also advocating for advancements and investments in those youth and young people impacted by homelessness and who are survivors of sex trafficking. Every child deserves to live in a place that is supportive, loving, and safe. Without proper investments in the lives of Nevada's children and young adults, we fail to invest in our future. Housing, safety, and compassion should not be a concern that children should have to embrace. Feelings of hopelessness and despair should not be the new normal. Sadly, these are the realities that many youth and young adults navigating through these systems are faced with. I would like to welcome Holly Wilborn, our Executive Director, to talk a little bit about our priorities around juvenile justice.
Thank you, Deshaun. And I just want to take a moment. I will again at the end of this.
Hey, Holly, we're getting some bad feedback from you. Yeah,
still bad?
Still, yeah.
Is this better?
Yeah, it's not better.
Okay. All right. Well,
Okay, just a small technical difficulty. I do believe that Dr. Rains, you were going to add something in this section. Is there anything that you would like to throw into here?
No, I was going to speak a little bit with Deshaun about our priorities around restorative practices. And I know that came up earlier in our conversation. You know, I think Annette raised an excellent point in that we've not seen a rollout of restorative practices, but what we're hearing from the governor's office is that they would like to roll back a practice that hasn't been rolled forward. And so we want to make sure that we are working to implement evidence-based practices. We know that our diversion programs, at least here in Clark County, have been successful at, such as the Harbor, successful at providing wraparound services and supports for children and families who are justice system involved. And we want to see the growth and support of those type of programs. Deshaun, any other points that we would like to touch on regarding our work with juvenile justice and our aims for this session?
No, I think you covered it all. I think it is, just to reiterate, really is making sure that our youth are well supported, that they have those supports in place. And so we're advocating to make sure that those reforms that were supposed to be implemented are implemented and nothing is rolled back.
Yeah. And Gard, I see your question about how do we educate folks on what this really is, right? And I think that comes with each of us taking the time to educate ourselves. And so we will we will provide some information with the thank you for your attending this summit that can help you better understand what do restorative practices do. You know, restorative practices are about prevention. They're about building community. They're about making schools a healing and safe space so that students don't want to engage in the types of behaviors that would get them removed from the school. And if they do engage in misbehaviors or behaviors that aren't considered helpful to the learning environment, we want to see the students make repair and re-engage in their school community and not be seen as an outcast, not be seen as a problem. And so it's important that we do work to intentionally say restorative practices doesn't mean students don't have consequences. Like that is not true at all, right? Like we want the students to have a consequence that feels natural, and then we want the students to have the opportunity to make repair. We are very fortunate in that we have Larry Ham here from Congressman Horsford's office, who would also like to speak on this matter. Larry, do you have something to add? What would you like to add?
Yeah, like I said, Larry Ham, District Representative for Congressman Stephen Horsford. First of all, I want to thank Children's Advocacy Alliance. You guys have been amazing through the COVID relief. We had the privilege of being with Dr. Garner at the time. And we had the privilege of attending some of your events on there, as well as having the congressman on there. So on the federal level, as you may know, we're just starting the Congress, so it's kind of a boring time where we're kind of waiting to see what our committee assignments are. Right now, the congressman is, of course, chair of the Congressional Black Caucus, which is huge for him, as well as we know he's going to be on the Committee on Financial Services. We're just waiting for his subcommittees. And we also think he's going to be on HASC, but there's no official set on the rest of them. We know he's been on financial services, just not the committees. Speaking on some of the questions that were brought before, there wasn't a federal effort to increase the minimum wage, but unfortunately it died in the Senate. Just the way Congress works, these bills get bounced back and forth. It was initially tried to pass in the COVID relief bill, but it was stripped out of the bill, unfortunately. But that was something that I know I can speak for the majority of the delegation, that they were supportive of increasing that wage, but you have to get support from both sides of the Congress. So, you know, and right now it's probably not going to pass because we have a Republican Congress and they're not for it. So I would love to, and you know, a congressman's going to be supportive of that in any way he can. I just don't see it being passed this Congress. Really want to focus on what we've done. So we've had the Bipartisan Safer Communities Act, which is a large priority for the congressman, with his big Breaking the Cycle of Violence Act that was included in that. I have a copy of a CRS report that breaks down the whole bill, and I'm going to put my contact information if anyone wants that. That's not the right one. But you can contact me and I'll send you a copy of that. There's a lot of grant funding that might be able to help alleviate some of these issues, such as mental health services in schools, pediatric care, as well as issues that really focus on helping families heal from these instances of violence and building up the community. We're also going to be looking, if you're on national TV, there's also a push for introducing the George Floyd Justice and Policing Act as well, which the congressman is working on. So as far as advocating, we want to hear from you. You do have to be in the 4th Congressional District for us to get your input. So you can do that on horsford.house.gov. Under the contact, just put in email. As an individual, it's best if you just have an idea of what the bill number is. That's incredibly helpful for us in your stance. You can go into detail, but it's not necessary. If you just want to voice your opinion to tell us to support a bill, to say, hey, I want you to support HR, whatever, because whatever, that's fine. And that all those do get tallied. That is considered in his vote, and that's the best way you can advocate as an individual. And you can also join organizations like Children's Advocacy Alliance that advocate for newer policies and creation of those policies. But if anyone has any questions of me, I know you're short on time, so you can just drop me an email or you can contact me at 702-963-9360. Thank you.
Thank you so much. Thank you so much, Larry. We appreciate you being here and being available. Deshaun, did you have anything to add before we transition?
No, I end with this quote by Nelson Mandela: safety and security doesn't just happen. They're the results of collective consensus and public investment. We owe our children, the most vulnerable citizens in our society, a life free of violence and fear. And so now I am turning it over to.
I actually did have a question for Larry that I put in the chat according to Holly's instructions.
Mr. Jameson, send me an email and I will forward the whole bill because there's quite a few grants that come along with that. And it will also have the wording for what kind of policy that affected. But most of those grants are through SAMHSA or Health and Human Services.
But is there a timing to it, Larry? That was my question.
The last I've seen, I saw a schedule because we got a first announcement of the first round of grants. It looks like they're doing it bi-yearly, like every year, and it's set to be funded until 2026.
Okay, thank you so much.
No problem, sir.
Thank you so much. I am now going to turn it over to my colleague Shelly Speck, our foster parent coordinator. She'll share more about the Children's Advocacy Alliance's initiatives to ensure parents and caregivers are influencing policy in the state. Shelly?
Hello, everyone. Good afternoon. I'm glad to share space with you all and talk a little bit about family engagement and community partnerships. Again, my name is Shelly Speck and I live in Gardnerville, Nevada. And I am happy to join you all today to talk about change. Where does it begin? It begins at home. Families are their child's first and most important teachers and advocates, including parents. They know what they want and need for their children to thrive and flourish. The development of community outreach and engagement must be informed by families and the voices of others with lived experience, so their perspectives will be integrated into decision-making when deciding how to best help those in our communities. When providing community outreach, if we don't have parent voice in the equation, then do we really know what kind of impact that current services and state legislation are having on families? Because sometimes the data doesn't tell the whole story. So how are we as community organizations ensuring all families receive the services they need based on their individual circumstances? Inclusion. Making sure we are engaging the families that are in the closest proximity to the problems and the barriers we are working to solve. So from inclusion, we look at diversity. We're looking at bringing more voices to the table. Rural and urban families, we need to talk to special needs and abilities, focus on race and culture, speak with fathers, mothers, grandparents, adoptive parents, foster parents, pregnant and young mothers. Don't leave anyone out when you're looking for trying to get, the data that tells a story. So I want to talk a little bit about how I got into advocacy and how my journey began. I have a 7-year-old and he was diagnosed with an intellectual disability through Child Find. And it was then that I discovered that we had a lack of resources in the community and subsequently in the schools within Douglas County. So I asked myself, well, what can I do? How can I make an impact for myself and others facing the same circumstances? And how can I help to close the gap and disparities among states for IDEA, federal dollars, where Nevada is grossly underfunded? So look at the resources. As state officials and community partners, we must ask parents, what are the resources in the community that you might need? What are the struggles and what does it look like? And what can we add to be successful? So assessment, we must do an assessment. Are the right resources reaching marginalized communities? I think we gain a different perspective in doing community outreach. And so I want to speak on equitable access to healthy food choices and healthcare so that babies and children can thrive. And that leads to healthy bodies. Happy and healthy babies come from happy and healthy parents. So there goes mental health into the equation. Structure, parent supports and services. We need housing, early intervention in some cases, early learning, wellness check-in and visits. That's going to ensure your mental health is safe and secure in the homes that we're trying to raise children in so our children can thrive. So when we're talking with parents, you want to ensure that you have a feedback loop. You got to let the parents know how their voices are impacting change. You got to help the parents assess their own communities and what is happening in their own community and what is and isn't working, what needs to change, and how can that change happen? So in conclusion, when we talk about community organizations, community health workers, early childhood and healthcare professionals and state legislatures, we can all demonstrate the ability to assist in passing legislation and furthermore, ensure implementation of coordinated services based on client or community assessment and family and parent input. So please commit to listen and learn from and support what families and communities value. The goal of creating equitable access is not necessarily to ensure 100% participation in the offered programs and services, but the goal is to listen to what families, in particular families of color, what they need and to identify strategies to support that preference. And this helps to establish relationships with families. And when we're gathering information, we got to seek to understand parent and family preferences. What kind of programs or services would they like to have for themselves or for their infant and toddler? What program and service use? What kinds of programs or services are they currently using and why? Are their programs or services effective? And trust. To what extent do families have concerns, if any, about participating in the identified program or services? What has been the historical experience of families like theirs when interacting with government and community-based resources? Is something like immigration status a barrier? So when we look at community and family input, and we're looking at, engagement, I think of a cake recipe. And so you have the right recipe, but without the right engagement of parents and communities or the ingredients, the recipe will not work. So we all need to work together in the best interest of Nevada's children, infants, and toddlers. And I appreciate the time that you all took today to share with us. Thank you. I'm going to turn it over to Holly Wellborn, who's going to conclude our session today. And thank you again.
Hello, Holly is navigating.
Let's try this again. Is that working?
Yes, you're back. Thank you.
That's great. Thank you, everyone, and thank you for dealing with all the technical difficulties. I'm having trouble with my filters, with the whole thing, but we did it, and I'm incredibly proud of this team. I'm incredibly excited about the turnout. Thank you, everyone, for taking the time to spend the last few hours with us, and we look forward to building on these relationships and providing more information to stakeholders, to parents, and for everyone that's involved in children's advocacy and providing the best possible outcomes for children and families. There are a few things, asks and requests that we have of you. Most of you are likely on our listserv and stay up to date with what CAA is doing. We intend to, that's perfect, please. So we intend to keep folks involved, to have a series of trainings throughout the legislative session. Some of the things that we would like for you to get involved in are to subscribe to our mailing list on caanv.org. Subscribe to that or spread the word. And if you know anyone else who's working in this space or who might want to get involved, especially parents or children who are, maybe perhaps formally system involved, whether that's in the child welfare system or the juvenile justice system, we definitely want to make children impacted by these policies front and center of the work that we do, as well as parents who are impacted by these policies. So please do that. And we also want to update everyone about Children's Week. Children's Week is the third week in March. There will be activities every single day of the week in certain areas. So we encourage you to take a look at that website. I just put all that information down in the chat. You can sign up and register for Children's Week there. There's opportunities for folks who are from Southern Nevada to get transportation from Southern Nevada to Carson City. So there is still time to register for that. So if you have an interest, please look at that Children's Week link that I provided for you there. And of course, follow us on Twitter and all of our social media. And if you have an interest in participating in our parent ambassador group, please do not hesitate to reach out. Together we can move forward. I'm excited about this legislative session. I'm excited about this team. Thank you to our legislators who came out today. And we're looking forward to an incredible legislative session. Thank you.
Holly, there's a question in the chat asking if CAA is hosting a bill tracker this year.
Yes, we will be working in conjunction with our friends at NIC at the Nevada Institute for Research and Policy at the University of Nevada, Las Vegas, in hosting a bill tracker on our website. We're figuring that out. We hope to have it published on our website by the second week of session. We're working to get that link on there, but we will be tracking legislation. If you have an interest in taking a look at what we are tracking now, we can certainly share that information with you, but it would be available both on our website and NIC's website. So if you have an interest in that, please contact us. Don't hesitate to contact us. And look, she put it right down in that chat right now. So any questions that you have about the legislative session, please don't hesitate to reach out to us or to reach out to me, holly.wellborn@caanv.org.
Thank you everyone for coming. There are no further questions.